Hi, I'm Dr. Chad Perkins, family physician. I grew up in a medical home, interested in healthcare. My father was a physician, mother was a nurse that worked here in the health system. Kind of grew up in the backyard of the hospital and just became very aware of how gratifying a career in healthcare could be based on the family that I grew up in. Like the continuity of care and like the ability to get to know patients, know them over the course of time, being involved with people as they change through life from child to adult and adult to families. For me, it's been the continuity of the relationships. I still do some education with students and residents, and it's nice to have them come and learn and watch and see the value of knowing someone for 10, 15, 20 years, of providing their care and the trust and the value that that brings to those people, and I think the enhancement it brings to helping them steer themselves through healthcare choices. I think being patient-focused, and particularly patient-focused from the standpoint of listening, is absolutely critical. And I think the listening component of communication is probably the one that often is missed out on in the engagement of patients. And I think having had that opportunity to have the time to see somebody not only once but again and again over a number of years, that really does bring, I think, an opportunity to do well by them. And I think they develop a comfort with you where they do become, very steered by the guidance that you give, because you've put in the time and you have listened and tried to understand them from their perspectives and backgrounds. So I have 3 kids, and they're all pretty active in school and sports. I've been a volunteer soccer coach for 17 years in the community, coached for a high school that I also attended, and have a number of former players who are now in the healthcare industry. So I like to think that I not only coach them on the field but off.